Hello, everyone. I'm your host, Doc Bob Lee, and you're watching Open. It's the live interactive program that brings the Bronx and New York City straight to your TV set. You can stay connected to us through social media at BronxNet TV. Leading things off, our first guest is the Vice President of Neighborhood Health with Public Health Solutions, and he joins us today to speak about a recent study indicating how the pandemic has negatively impacted New Yorkers' ability to receive health coverage. Please welcome to the show, Zach Hennessey. Zach, welcome.
Thank you. Thank you for having me, Dr. Lee. It's always a pleasure to be in the Bronx.
There you go.
I started out in the Bronx, actually working for a small nonprofit in the South Bronx, helping runaway and homeless youth. So it's always a pleasure to show up for the Bronx.
Well, listen, thank you for your service. Tell us about the connection between the Neighborhood Health Plan and the Public Health Solutions.
So Public Health Solutions helps New York City families and communities to achieve optimal health and build pathways to reach their potential. And as a very large public health organization, we have been very busy, as you can imagine, during COVID-19. And we have felt very strongly that we needed to get a sense of how people were doing, how they were faring during this pandemic, particularly low-income people who use our services. The services we offer are in the areas of health insurance enrollment, maternal and child health, food and nutrition, sexual and reproductive health, tobacco control, and HIV/AIDS. We really wanted to do this survey in order to better understand where people were doing, and also make sure it was citywide, including the Bronx, because we serve a lot of people in the Bronx and are also partnered with a lot of wonderful organizations there as well.
Tell us more about the survey.
So we conducted a survey with 1,000 New Yorkers, and what we found, it was a telephonic survey. And what we found was that the lowest income people who participated, those who reported receiving government benefits like SNAP and WIC, were more likely than others to have missed needed preventative health care, like regular physicals, in-person medical visits, prenatal care, and even vaccinations for their children. So for example, 45% of these respondents, these lowest income respondents, missed a regular physical versus 33% of others. And 5% missed a vaccination for their children versus 1% of others. So this will likely have long-term health consequences and contribute further to the health disparities that we see here in New York City.
Yeah. Can you describe the pandemic's impact on New Yorkers beyond the virus?
So we asked about COVID-19 specifically and how that was impacting them and what kind of COVID-19 testing and care they had gotten. And again, we saw, we compared wealthy and low income respondents, and we saw that a much smaller proportion of low income respondents had received any type of COVID-19 care, whether that was testing or treatment. Again, when it came to testing and treatment, something like 57% of wealthy respondents had received some type of treatment versus 36% of low-income respondents.
So they're not going to get checked or tested because of the low income? How does that pan out?
No, this isn't causal, but it has to do with what we know about how the pandemic affects people's lives, how many people have to continue showing up at a place of work versus how many people are working at home, how many people are juggling multiple needs related to their benefits, how many people have lost their jobs. So oftentimes when, and I'm sure you can relate to this, you have priorities in your life, right? And sometimes health isn't at the top of the list. Your kids might be at the top of the list. Your job might be at the top of the list. And so these things are affecting access. And what it means to have health equity is to make increased access where you see people have less access and remove barriers to access. So that's what we're hoping to do as a result of this survey.
And the results of the survey go to whom? Government or local officials, or
So
how do we utilize the results?
We will use this for policy and advocacy, and also fundraising and development, so we can try to fill some of the gaps that we see. So, for example, in the Bronx, we see that perhaps this preventive health care and COVID-19 care access is being interfered by a need for food. So people are really struggling to put food on the table, and that might be their top priority right now. So we provide food-related services in the Bronx. We're going to advocate for more funding in the Bronx. We're going to take this to our government officials and show them the high rate of food insecurity that we're picking up on these surveys. And hopefully that will lead to more funding and access.
Yeah. So you don't only provide, you're not only doing the survey, but you provide services. You mentioned the food services.
Yeah.
What are some of the other services that you provide?
In the Bronx, we have a center that's in East Tremont where we provide SNAP and WIC and health insurance enrollment. But we also partner with a bunch of great organizations in the Bronx, like Bronx Works, RAIN, Health People, Community Healthcare Network, around food and nutrition access. We fund pantries, and we have a coordinated intake for food and nutrition services, which we are actively fundraising for, to help people get connected to SNAP, WIC, home delivered meals, medically tailored meals, pantry services, and senior home delivered meals. And so we will definitely be using this survey and the high and increasing levels of food insecurity that we see in the Bronx to direct more resources to food.
How can the community help?
Well, the community can help by sharing us as a resource. We changed our website, so in this virtual era, you no longer have to find a location near you. You can just enter your information on our website if you need food and nutrition support. So sharing our organization as a resource for people to use, letting them know that we have resources available for them in the Bronx that include many pantries, many home delivered meal programs, and we can find a resource for them that works best for them in their communities. And also being sure to encourage their friends and family members to not be afraid to get tested, to access healthcare. We have seen, chilling effect for immigrant communities related to public charge. That's another thing that keeps people away. We can direct people to health, safe resources for their health where they can get care confidentially if they're reluctant for those reasons.
Are you preparing for any vaccines to be available to the community?
So we are part of a COVID-19 Rapid Response Coalition. And as a part of that coalition, that includes health systems, managed care organizations, and community-based organizations. We are all gearing up for what this vaccine distribution plan will be. We will follow the direction of our state and city officials, of course, but in the meantime, there are things that community-based organizations can do. If we are giving a presentation on that in December on what community-based organizations and healthcare providers can do to prepare for the vaccine. So if any organization wants to join, they can certainly get in touch with us and we'll sign them up for that coalition.
Thank you so much. Where can we go to look at some more of the information that we spoke about?
www.healthsolutions.org.
Zach Hennessey. Thank you so much. Thank you for your service, and thank you for
Oh,
all that you're doing in our
thank
community.
you, Dr. Lee, for having me. I always am ready to show up to get the word out.
All right, there you go.
Right.
Zach Hennessey, Public Health Solutions. You have the solutions. All right, we'll let people know more about it. Thank you so much. Have a
Thank
great
you.
day.
Have
Stay
a wonderful
safe.
day.
God bless.
Stay safe.
Yeah.
God bless.
Yeah. We'll take a break. We've got more. We're open.